I do want to talk about statins a little bit from a diabetic point of view. On the average, and there are lots of studies, there's a 40 to 80% increase in type 2 diabetes in people taking statins. So some studies say 12%. It's going to vary. And it also is a genetic variation. So depending what your genetic background is, you may have 80% or you may have 40%, but that's huge, okay? And if diabetics take statins, which is very common because they're worried about heart disease, because 75% of diabetics will die of heart disease. So this is a big problem. So statins are even worse when they give them to diabetics. So I never use statins because we have natural ways to do it. It's called change your diet, okay? It's called fasting to bring these things down even quicker if you're really too high. So that's the point. It's like, this isn't hard, and the trouble with the drugs is that they become a substitute for doing the work of getting healthy.
So I try to simultaneously agree and disagree, but that's not possible, so I'll have to do it sequentially. Okay. I have many cardiology colleagues who will go out to eat with me, and I'm looking at that steak they're eating, and they're saying, oh yeah, that's fine, I'm taking my statin. And I completely disagree with that.
Right.
And we should be doing much more in the way of prevention. And yes, we are enabling by lengthening the people's lives. No question about that. However, the fact that the matter is the drugs do work, and that's why we're in such trouble, as I mentioned before, because people are living longer, sicker lives. Now, the part that
being healthy works too. That's the key.
It does, and that's why we're all here.
That's not quite accurate, because they would have lived much longer if they would change their lifestyle.
No, right? No. Right. That's what we're saying. The same thing.
Okay.
That is, we need to be preventing diseases instead of pulling people out of the river, which is stop them from falling in the first place. And so we're in agreement about that. However, once you have people who are in trouble, there are things that you can do to help them, and the drugs do have a role there to try to reverse the effect. Somebody coming to me with 3-vessel coronary disease and having, 70 years of a bad diet, I can do better with all guns blazing. Sorry, I'm from Chicago. That was a bad thing to say. Okay. But with a rehab program, adherence to medications that are guideline-driven, plant-based nutrition, weight loss, every aspect of it, we'd leave no stone unturned. But you're absolutely right. If we could, and this is why we're here, because we want to stop people from getting into that situation in the first place, and we should be able to. And hopefully we will get to the point where, why would we take drugs for something like that? For the diabetes issue, there was the CARDS trial. It showed a 23% decrease in cardiovascular events if you added statin. And it's interesting that the company that did that used a relatively low dose of statin. Why? Because it's high-dose statins that tend to increase diabetes. Now, implicit in what you said it was an 80% increase. If you increase from a 1% incidence of diabetes to 2%, that's a 100% increase. So the question is it clinically significant, and who gets it? It's people with metabolic syndrome, which goes back to Dr. Fuhrman's point. Why do people have metabolic syndrome? Because of central obesity. So if you did the right thing, you would. There are people who would tolerate statins and never develop diabetes because they have a good lifestyle. So these actually can work hand in hand. It would be nice if the drugs were unnecessary, but they can actually be very helpful. But I would never want to replace lifestyle medicine with drugs.